So good time. Scooch a little bit over. This a bit, actually.
That's all good.
Okay, so can I frame a little bit?
Yep.
Awesome. Okay, so before I would go ahead and enter the patient's room, I'm going to check the chart to see what we're doing today. And I'm going to go ahead and enter the patient's room, shut the door as to provide the patient with privacy. I'm going to perform hand hygiene. I'm going to go ahead and introduce myself. So hi, I'm Miguel. I'm going to be your nurse today. Do you mind telling me your name and date of birth?
Yeah, my name is Tyler Maurice. My birthday is May 29th, 2001.
Awesome. And do you mind if I see your wristband? You just
Yeah.
touch your wrist. Perfect. All right, so after using these two identifiers, we now know that we have the right patient. We can go ahead and let them know what we're doing today. So it says on your chart that you're just here for a checkup. So I'm just going to be doing a head-to-toe assessment on you, okay?
Yep.
Okay, awesome. So just starting off, I'm going to check his A&O, see how he's doing. So you say your name one more time.
Tyler Maurice.
Okay. What's the year?
The year 2001.
No. What year is it right now?
Oh, 2021.
Okay. And who's the president?
He's president?
Yeah. No, like you.
Joe Biden.
Joe Biden. Okay, perfect. So the patient is alert and oriented ×3. Looking at the patient right now, he is well groomed, appropriate mood and affect, and now I'm just gonna go ahead with some subjective questions overall. So I'm gonna let you know, like I said, we're doing a head to toe. So I'm gonna be doing an HENT assessment on you. I'm gonna be checking your lungs, your heart sounds. I'm gonna be checking your abdomen, and I'm also gonna be doing a neuromusculoskeletal assessment on you as well. Okay.
Okay.
So subjective questions starting off from your head. Okay. Have you ever had any severe injuries to your head?
No.
No. Okay. Any concussions?
No.
None.
Mm-mm.
Any brain surgery whatsoever?
No.
No. Okay. And you obviously wear glasses.
Yep.
So how many times a year do you go to the eye doctor?
I go about once every 2 months. Or no, excuse me. I go once every 6 months.
Once every 6 months. Okay. So twice a year.
Yeah.
Okay.
Twice a year.
Okay. All right. Do you use contacts as well, or just the glasses?
Just the glasses.
Okay. Do you ever have trouble seeing? Like, do you have trouble seeing without them? Like, can you drive or?
No, I can't drive. I can barely read with them
Okay.
off. So.
Okay. Gotcha.
Mm.
Okay. All right. So now we're gonna be going over to your ears. Have you ever had Have you ever had any difficulty hearing whatsoever?
No.
Any use of a hearing aid?
No.
None. Okay. Has there ever been anything lodged in there? Anything stuck?
No.
No.
Yeah.
Okay. Perfect. So now we're gonna go down to your nose. Okay. Do you ever have any difficulty smelling whatsoever?
No.
No. Okay. Bloody noses?
Just occasionally.
Occasionally. Okay.
Yeah.
Do you have any allergies?
Yes, I do. To pollen.
To pollen. Okay. Do you take anything for that?
Yeah, I take I forget what it's called, but I do take allergy medicine.
Okay. All right. Perfect. But we'll figure that out later. What you take. Okay. So now we'll go down to your teeth. How frequently do you visit the dentist?
About per year, would you say, or just in the general time set of time?
Well, how frequently do you go?
I'd say about 5 times a year.
5 times a year you go to the dentist. Okay.
Yeah.
All right. Have you ever had any braces?
Yes. Mm-hmm.
No. Do you still wear your retainers?
No. I'm
Okay.
getting new ones.
Okay. Gotcha. Oh, shoot. The video's or the camera's falling. Okay. Perfect. Okay. So for your mouth. Okay. Your throat. Do you feel any soreness in your throat right now?
No.
Okay. So HENT patient stated that he goes 5 times a year to the dentist, twice a year to the eye doctor. Has never had a serious injury to his head. No concussions.
No.
No concussions. No problem hearing whatsoever. So now what we're gonna go ahead and do is we're gonna move over to neuromusculoskeletal portion of subjective questioning. So for this, you know what, I'm just gonna prop this up on something else. Here, I'm sorry. Okay, so for neuromusculoskeletal, do you ever feel any weakness in your arms or any muscles really?
No.
Any tingling, any numbness ever?
No.
No. Okay. Good. Have you ever broken a bone?
Never.
Never. Okay. Now for the neural part, how do you feel today? How do you mentally?
Fit. Good. Very
Good.
good.
Do you feel depressed whatsoever?
No.
No. Any suicidal thoughts?
No.
No. Okay. Good. So after asking the patient these questions, I can say that there's no risk for mental illness, and if there were, we would go ahead and perform further assessments. But it doesn't seem necessary for now. Okay. And also, while looking at the patient, his skin is appropriate for ethnicity. There's pink undertones in his upper extremities, lower extremities, in his neck, or on his neck and his throat. He has good posture. His mood and affect, as I said previously, is appropriate for the situation. He doesn't seem to be using any accessory muscles while breathing. The nares aren't flaring whatsoever. He is clear and coherent. His speech is very, very clear. I can understand him very well. Okay, so now we've done HENT, we've done neuromusculoskeletal. Now I'm going to ask you some questions about respiratory, okay?
Okay.
So breathing. Do you ever have trouble breathing?
No.
No. Have you ever had asthma?
No.
Never. Okay. Any family history of any lung disease?
Just on my dad's side.
On your dad's side?
Yeah.
Do you know what it was?
No, I don't.
Okay. All right. Okay. That's all right. No worries. But you yourself, you don't have any?
No.
Have you ever had any surgery on your lungs whatsoever?
No.
No. Okay. Perfect. Moving on to cardiovascular, and this also incorporates the respiratory. Do you have any chest pain whatsoever?
No.
Do you feel any pain like at all throughout your body?
No, but under like the right situations, like if I'm working out, sometimes
Right.
like heavy breathing and
Right.
whatnot. But
Right.
otherwise, no.
Okay. So other than working out, your breathing is regular. It's not labored.
No.
Okay. Perfect. So going back to your heart, no chest pains ever really, like any shooting chest pains.
No.
Okay. Any history of any family history of heart disease?
No.
No. Are you a diabetic?
No.
No. Okay. All right. So patient has stated that there are no previous personal diseases when it comes to respiratory nor cardiovascular, except for some family history of some lung disease. So now moving on to abdominal. How frequently would you say that you have a bowel movement?
I'd say just 2 times a day.
2 times a day. And how often do you urinate?
I'd say about just 4 times a day.
4. Okay. All right. Okay. Is there any burning sensation when you urinate? No. Any pain, like whatsoever, whenever you have a bowel movement?
No.
No. Okay. Any cramping ever?
No.
No. Okay. All right. Very good. And going back to musculoskeletal, actually, how frequently would you say you work out? Because I know you said that you feel sore after your workouts.
Yeah, I'd just say a few times a month.
You work out a few times a month?
Yeah.
Okay. All right. No worries. Do you play any sports?
I used to.
Okay.
Yes. So.
All right. Okay. So abdominal, respiratory, cardiovascular, neuromusculoskeletal, and the HENT. The patient does not have any diseases himself, so that would indicate that we shouldn't find any abnormalities today, but just in case, I will note them. So I'm gonna start from the top of your head down to the bottom of like your feet, literally. Okay.
Okay.
So I think what I'm gonna do right now actually is I'm gonna get out the way, checking your cranial nerves. All right.
Okay.
So for this, I'm gonna have you go ahead and you know what? Or no, I didn't scan that part of it. So I'm just gonna have you go ahead and smell this and go ahead and tell me what you smell. Okay.
Okay. Just a strong, pungent flavor, I guess.
Okay. All right. No, you can smell it though.
Yeah, I can smell it. Yeah.
Perfect. So this would indicate that the olfactory cranial nerve is intact. So for cranial nerve number 2, which is it's the visual cranial nerve.
Yep.
I'm gonna have you go ahead and read the top of this. Okay.
Yep. Get up drinking,
Okay. Next one.
hit the road and roar.
Okay. Third one.
Take a break and relax.
Perfect. Awesome. Good job. So cranial 1 and 2 aren't intact. Now for 3, 4, and 6, what I'm gonna have you do is I'm gonna actually have you take off your glasses for a little bit.
Yeah.
Go ahead and put them down there. And I'm gonna be doing a pearl assessment on you. Okay. So real quick, I'm gonna go ahead and measure your pupils. All right, and I'm gonna say your pupils are at about 5 millimeters. Okay. And now what I'm gonna do is I'm gonna see how they react to light. Okay. If they restrict, if they both restrict, if they're equal, if they're bilateral. Okay.
Yep.
All right, so I'm gonna go ahead and cover this side and introduce some light. Yeah, I'm gonna have you go ahead and face the camera a little bit.
Yeah.
Awesome. So go ahead and look at me. Perfect. All right. Good. Perfect. All right. So both pupils were able to restrict. Both pupils restricted. They reacted to the light that was presented from the side. The sclera is clear. His eyes are white. His eye color is like a green blue.
Yeah.
You'd say? Yeah, green blue. And now I'm going to be doing an accommodation test on you. Okay. So
Okay.
what I'm going to have you do is I'm going to have you stare at the tip of my finger. I'm going to have this one over here, and when I tell you to switch, go ahead and switch. Okay.
Okay.
Okay. So stare at this one. 3, 2, 1, switch. Okay. So the patient's eyes were able to accommodate. Both of them were able to shift on to the other point of interest. There was no lag. There was no waiting whatsoever. So that's good.
Yeah. Cool.
Yep. And that was 3, 4, and 6. And for 5, the TMJ, I'm gonna put my fingers right on your jaw, and I'm gonna have you open and close. Okay.
Yep.
All right. So open, close. Perfect. All right. I didn't feel any popping or any crackling when I did that. So 5 is intact as well as the previous ones, and we've already assessed 6, so we're gonna jump straight to 7. Okay.
Yep.
So what I'm gonna have you do is I'm gonna have you raise your eyebrows and puff out your cheeks like this.
Okay.
Okay. So go ahead and do it. Perfect.
Okay.
Good job.
Yeah.
All right. So 7 is also intact. For 8, I'm gonna be doing a whisper test. So I'm gonna go ahead and go behind you. And just go ahead and repeat after me, okay?
Yep.
So, okay. Awesome.
Yep.
Thank you. Baker. Perfect. You can say it in a normal voice.
Okay.
That one was right. That one was right.
Okay.
Glass.
Glass.
Awesome. Okay. So patient's auditory cranial nerve is intact. Now for 9, I'm just gonna ask, do you have a gag reflex?
Yes.
Yes. Okay.
Yeah.
Do you mind going ahead and swallowing for me like this? Perfect. Okay, so 9 is intact as well. And for 10, I'm gonna go ahead, look inside of your mouth. All right, so I'm gonna have you open up. Say ah. Perfect. All right, so the uvula is midline in the patient's mouth. Uvula and the soft palate did raise. And so 10 is intact. And for 11, I'm gonna have you just shrug your shoulders. Perfect.
Just like this.
Yep, just like that. Perfect. Yeah, do it one more time. Perfect.
Okay.
All right, so 11 is intact as well. And for 12, I'm going to have you say light, tight, dynamite.
Okay.
So,
Light, tight, dynamite.
perfect.
Yep.
All right, so all cranial nerves are intact. So I'm going to go ahead. I'm going to move on from that. So I'm going to inspect what I can right now. So just look straight at me.
Yep.
Looking at the patient, you can go ahead and put your glasses on actually, if you want.
Yeah.
So looking at the patient right now, his eyes are equal bilaterally. They're symmetrical, as are his ears. Looking at his nose, his nares aren't flailing. They're not flaring. His lips, they do look moist. They look pink. I see no masses, no lesions on the patient's neck. Like I said earlier, his skin on his upper, lower extremities are appropriate for ethnicity with pink undertones. So I did that already. And now what I'm gonna do is I'm gonna have you stare at the tip of this pen, okay? And without moving your neck, just your eyes.
Yeah.
I'm gonna have you just move with it, okay? All right, and we're doing this to assess your 6 cardinal gazes. Perfect. All right, so the patient does possess the 6 cardinal gazes. Okay, and now what I'm gonna do is I'm gonna check your nose. So I've already done all the subjective questioning that I need to do. So while I do this, I'm gonna palpate right here on your maxillary and your frontal lobe. Okay.
Okay.
So while I do this, go ahead and let me know if you feel any pain. Okay.
Okay.
Okay. So looking at it right now, I see no masses, no lesions on his nose. So I'm gonna go ahead and palpate. Anything?
No.
Anything?
No, everything's fine.
Okay. Perfect. So no masses, no bumps were felt on the patient's frontal nor maxillary. And looking at him right now, I forgot to mention that his eyes, I see no discharge. I'm actually gonna go ahead and pull down like this for me on your eyelids. Perfect. Okay, so the conjunctiva is pink. It's moist. No discharge present. And looking at his nose right now, there's also no discharge. But I'm gonna go ahead and take a closer look. So I'm gonna have you look up at the ceiling a little bit. Awesome. Perfect. So after looking inside the patient's nose, I saw no perforations in his septum. The flesh inside of his nose it's moist, it's pink, no drainage, as I stated earlier. Hair is present as well. So now we're gonna go ahead down to your mouth, okay?
Yep.
So one more time, I'm gonna have you open up. Don't say ah. All his teeth are present, as is his uvula. Do you still have your tonsils?
No.
No. Okay. All right. Okay. His buccal mucosa, pharyngeal wall, his gums, and his tongue, they are pink, they're moist. There's no signs of bleeding. All his teeth are present. I did notice his soft and hard palate did raise, as did his uvula. The patient also stated that he had a tonsillectomy. So after that, now what I'm going to do is I'm going to go ahead and check your ears, okay?
Yeah.
Alright, so going ahead and look inside your ears. Here, I'm going to have you turn this way actually. Okay, just so that, there we go, perfect. Alright, so you're pinning your tragus in your mastoid process. What I'm going to do is I'm going to go ahead and palpate. I'm feeling for any abnormalities. I'm doing it on the other side as well. Okay, perfect.
Cool.
I'm going to pull up on your tragus and back to look inside of your ear, okay?
Yeah.
Okay. Alright, perfect. Alright, go ahead and turn around for me. So, the same. Perfect. Alright, so pull up and back. Okay, cool. Alright, so cerumen was present in both left and right ear. Hair was present as well, but no foreign bodies were noted whatsoever. How do you clean out your ears?
Q-tips.
Q-tips? Okay.
Yeah.
And you said you've never gotten anything stuck in there, right?
Yeah. No.
Okay. Perfect. I'm gonna go ahead and palpate the top of your head, okay?
Okay.
Alright, so I'm gonna go ahead. And right now the scalp looks intact. I don't see no rashes, no masses, no lesions. The skin is equal throughout. His scalp is freely movable. There's some dandruff, but it's whatever.
Yeah. Dry hair.
It's all good. Yes, so that is the HE&T assessment. But while I'm there, I can go ahead and do some more stuff. So what I'm gonna do is, right now I'm just gonna note that I don't notice any jugular vein distension on the patient's neck whatsoever. Later on, while he's laying down, I'm gonna check and see if it's present when he's laying down, and if it's still present when he's back up, that would be cause for concern. But I don't see it right now. So what I'm gonna do is I'm gonna go ahead and palpate your carotid arteries, okay?
Okay.
Alright, so I'm gonna locate it, it's right here. Turn and face the camera.
Yep.
Okay, so I'm gonna palpate right here. Okay, and I'm gonna grade that at a 2+. He's got a strong pulse. The same, perfect. And I'm not gonna do this on both carotid arteries at the same time because the patient could pass out and he could potentially die.
Oh.
And we don't want that.
Yeah, I don't want that.
Yeah. So now what I'm gonna go ahead and do is I'm gonna auscultate, okay?
Yeah.
So I'm gonna switch it over to the bell side of my stethoscope. And what I'm gonna do is I'm gonna have you breathe in, hold it. I'm gonna listen at the top of your carotid, middle, and lower, okay? And throughout that, I'm gonna have you hold your breath, okay?
Yeah.
And I'll let you know when you can release, okay?
Yep.
So go ahead and deep breath. All right. Hold. Perfect. All right, release. Okay. And we're gonna go ahead and check on the other side as well. Breathe in. Hold it. Perfect. All right. So what I was just looking for right there was any signs of bruise, but I couldn't hear any whatsoever. So good job on that.
Thank you. Thank you.
So now, before we move on forward, I'm gonna go ahead and I'm gonna check some lymph sites on you. Okay.
Okay.
All right. So starting at your preauricular, I'm gonna go postauricular and occipital to begin with. Okay.
Okay.
So I'm gonna
How do you want me
start kind of diagonal, a little bit more.
A little bit more like this.
Yeah.
Yeah, the other way. Okay.
There we go. And I'm gonna go ahead and feel for them. So preauricular right here, postauricular, and occipital. And I'm feeling for any lymphedema, any masses whatsoever. I felt none during those three. And for tonsillar, I have to do it from behind.
Yeah.
Okay.
Yeah.
So that's the best way to do it. Here, I'm gonna go ahead like that. Perfect.
This is good. There. Focus.
Okay. Okay. I'm not feeling any inflammation, no lymphedema. Now I'm gonna check here submandibular, submental, okay?
Yep.
So submandibular, submental, good. And now what I'm gonna do is I'm gonna be checking your supraclavicular, deep cervical, posterior cervical, and superficial cervical, okay?
Yeah.
All right, so I'm gonna go ahead and feel right here. Okay. So no masses, no lymphedema were felt, or was felt throughout the patient's lymph sites on his neck, and in his pre-post auricular nor his occipital. So that is good. That's what we're looking for. And also, while I was feeling the patient's skin, it was dry and it was dry or warm to the touch as well. Okay. Alrighty. So I think what I can do now is, give me 1 second to think. Okay. I can actually check your range of motion.
Okay.
So what I'm going to have you do is I'm going to go ahead and have you look to your right, all the way to to your left, or as much as you can. Go ahead and look up. Go ahead and look down. Perfect. So patient does possess full range of motion of his neck. And what I'm gonna do next is I'm gonna put my hands on your shoulders, and you're gonna go ahead and shrug against it. Okay.
Okay.
This is just to check your strength of it. Okay. Good. 5 out of 5 on that. And I'm gonna put my palm on your cheek. You're gonna go ahead and push against it like this. Okay.
Yep.
And then same on the other side. So go ahead. Good. Good. Awesome. So 5 out of 5 on both the patient's shoulders and on the patient's strength of his neck. So now, okay, all right. Sorry, I'm just
No, it's all right.
playing back through it. Just to recap right now what we've seen so far. Patient is alert and oriented ×3. Visits the eye doctor twice a year, dentist 5 times a year. He has no diseases whatsoever when it comes to cardiovascular or respiratory. And now no abnormalities were found on his scalp, in his eyes. There was no drainage in his eyes, ears, no bleeding in his mouth. Everything in there was pink, it was moist. Uvula was midline to his mouth. Yeah, no drainage whatsoever. So now what I'm going to do is I'm going to go ahead and move on to your respiratory. Okay. So I'm going to have you go ahead and take your shirt off if that's okay.
Yeah.
All right.
Yeah.
Good. Awesome. Thanks, Alan. Go ahead and sit back down. So looking at the patient's chest, it is appropriate for ethnicity.
Got some abs.
Yeah, dude, look, you're ripped, you're jacked. Looking at his chest, there's no use of accessory muscles. There's no overexpand or hyperexpansion of his lungs. His skin color is appropriate for ethnicity with pink undertones. I see no masses, no lesions, and no bruises whatsoever. And I've already asked you if you have any difficulty breathing whatsoever.
Yeah.
Okay, so now what I'm gonna do is I'm actually gonna auscultate your chest, okay?
Yeah. Yeah.
So before that, I'm gonna go ahead and map out your anterior lung field. And what I'm listening for is any adventitious sounds, if there's any crackles, any wheezing, any ronchi.
Yeah.
And if you have any of those, like I can explain them. So we're gonna start at the second intercostal space. So I'm gonna say right there, down to your fifth, okay?
Okay.
Okay, so 4, 5. Okay, so the patient's intercostal space, and his lung field, his anterior lung field is right here. So now what I'm gonna go ahead and do is I'm gonna go ahead and auscultate, okay?
Yep.
And we're gonna see if there are any adventitious sounds, making sure that we don't listen to his lungs over any bones. Okay, so we're gonna be going in a pattern where it's over, down, over, down, over, down, over, down, okay?
Yep.
All right, let's see what we hear. Go ahead and every single time I put my stethoscope down, I'm gonna have you breathe in and breathe out each time, okay?
Yep.
Okay, so I'm gonna start off at the apices. Good. Awesome. Awesome. Good. No adventitious sounds were heard whatsoever. Now what I'm going to do is I'm going to percuss throughout your anterior chest. Okay, so what that is I'm going to go ahead and take my finger and tap it what we're feeling for is some resonance. We're gonna be expecting some bounce back because your lungs are hollow. So let's start off right here. Make sure it's not over any bones. Good. All right, percussing the same places where we auscultated.
Cool.
Resonance was felt throughout the patient's anterior lung field. His skin is drawn to the touch as well on his anterior chest. And now what we're going to be doing is we're going to be palpating. Okay, so what I'm feeling for is any crepitus, any crackles, or any bumps. Okay?
Yeah.
All right, and let me know if any of this hurts. Okay?
Go.
So no bumps were felt whatsoever. No lumps. There's no crepitus felt whatsoever. Resonance was felt throughout the anterior lung field. I don't know if I said that already, but I did again. And now what I'm going to have you do is, in the chair, I'm going to have you go ahead and turn around.
Yeah.
So here.
Oh, here.
Here, just shift your body. Like, leave the chair the way it is.
Yeah, I shift it this way or that?
No, just your body. What are you, like, so you just face that one.
This way, okay.
Yeah, okay. So we're going to be checking the AP diameter, or the AP ratio of the patient's anterior and posterior chest. So we're going to take this and making sure that the ratio is 1 to 2, which it is. Which is good. That's what we're looking for. And you're stay that way.
See it?
Yeah. So now we're gonna listen to the posterior side of your chest. Okay.
Yep.
So first things first, we're gonna map out the patient's lung field on the posterior side of his chest, starting at C7, right here down to the bottom of his scapula. Here, Tyler, do this for me. Move your arm back.
Like this?
Yeah. Okay. So you're good. Go ahead and put it back. So from C7 down to T7 right here, move down 3 spaces. Okay, so C7, T10, this is his lung field right here. So this is where we're gonna be working. Inspecting him right now, he's got a few freckles on his back. No bruising, no masses, no lesions. Now what we're going to do is I'm going to be auscultating again, okay?
Yep.
Okay. So same thing. Every single time I put my stethoscope down, go ahead and breathe in and breathe out, okay?
Yep.
Starting back up at the apices. Go ahead. Okay. Okay. Perfect. Okay. No adventitious sounds were heard throughout the patient's posterior lung field. And now what we're going to be doing is I'm going to be percussing again, okay?
Yeah.
Alright, so Resonance was felt throughout. There was that bounce back during percussion. I can go ahead and palpate, see if we feel anything abnormal. Skin on the posterior side of the patient's chest is also dry. It's warm to the touch. Same as his anterior chest, and it's appropriate for ethnicity with pink undertones. Okay, so now what we're gonna go ahead and do is I'm gonna check you for tactile firmness. So what I'm gonna do is on the side of your spine, like the back side of my hand, like one on each side of your spine. I'm gonna go down, and every time I put my hands down, I'm gonna have you say 99. Okay.
Okay.
Okay. So go ahead and turn back around.
Yep.
Okay. And what we're looking for here is we're looking for the vibrations to diminish as we go farther down. So go ahead.
Yep. 99. 99. 99. 99. 99. 99. 99. 99.
Perfect. All right. So the vibrations did diminish as we went down the patient's back. And now what we're going to go ahead and do is I'm going to check your lungs for expansion. What we're looking for is, what I'm going to do is I'm going to go ahead and put my thumbs close like that. I'm going to have you breathe in deep, and they should move apart and come back equally.
Yeah.
Okay? And that's just to make sure that they are expanding equal bilaterally. Okay?
Okay.
All right. So I'm going to have you go ahead and deep breath. All right. Let it go. Perfect. All right, that's what we were looking for. So the patient's lungs do expand equally bilaterally. Perfect. No adventitious sounds heard whatsoever. So I'm gonna have you go ahead and turn back around in your seat. And what I'm gonna do now is I'm gonna go ahead and listen to your heart sounds. Okay.
Yeah. Yeah.
So I'm gonna be listening to his aortic, his pulmonic, his Erb's point, his tricuspid, and his mitral. And we're listening for to make sure that just S1 and S2 sounds are present, that there's no galloping, that there's no S3, S4. So I'm going to go ahead and do that now. Okay. So you can just go ahead and breathe normally.
Okay.
All right. So I'm starting off at the second intercostal space, right of the sacrum, for the aortic. All right, across to the pulmonic. Down one to Erb's point. Down a couple to tricuspid. Over and down 1, 2, mitral. Perfect. So the patient's rate rhythm, it was appropriate. There was no galloping whatsoever. Only S1 and S2 sounds were present. S3 and S4 were absent. The same thing as I said earlier, dry, warm to the skin, or warm to the touch, appropriate for ethnicity of the skin as with pink undertones. Now what I'm gonna go ahead and do is I'm gonna do range of motion with you right now, okay? So go ahead and lift your arms as high as you can.
Yeah.
Okay, go ahead and put them down. Okay, and with your palms out, I'm gonna have you go ahead and point your palms towards the ceiling.
Yeah.
Pointing back down to the floor. Okay, I'm gonna have you go ahead and do a bicep curl. Perfect. All right. So the patient does possess full range of motion of not only his neck, his shoulders, but also of his upper extremities. And now what I'm going to go ahead and do is I'm going to go ahead and check your pulses, okay?
Yeah.
So I think, here, move a little bit more over here. More a little bit this way.
Oh, excuse me. Yep.
No, you're good. Okay, so I'm going to feel from right there. Perfect. Your pulses are 2+, equal bilaterally. Okay, and this is brachial. We're going to go down to radial. 2+ as well on his radial pulses, equal bilaterally. And now what I'm going to do is I'm going to check your capillary refill on your fingers. So go ahead and stick your fingers out like that. So for these, as long as it's under 3 seconds, it indicates that you have proper circulation on your upper extremities. You do on your right hand, and same thing with your left hand.
Cool.
So both upper extremities, good circulation, both cap refill under 3 seconds. Pulses on his brachial and his radial there were 2+ equal bilaterally. The skin on his upper extremities are dry and warm to the touch. Appropriate for ethnicity, full range of motion so far on his upper extremities. And now I think what we can do is we can go ahead and head over here and we can do the rest of the assessment. So I'm gonna have you go ahead and lay down.
Okay. Just on my
Here
back.
with your head pointed that way.
Head pointed that way.
Yep. So just to clarify, my laptop is off. There's nothing really there. Okay, perfect. Just using the laptop as a stand to hold my phone.
Or
A little bit more over here, actually. Okay. So, what I'm going to check right now on the patient is I'm actually going to. Okay. So what I'm going to do right now is I've checked your range of motion on your arms. Now I'm going to check it on your legs. Okay.
my legs.
So bring up your leg. Bring up your knee. Okay. Good. Put it back down.
Yeah.
Other way. Good. Okay. So I'm gonna put my hands on your feet. Okay.
Yeah.
So I should test your hand strength.
Yeah.
So with my hands like that, go ahead and pull it towards you. Good.
Okay.
And go ahead and push against me. Good. So the strength in the patient's upper extremity is 5 out of 5 as well. And now what I'm gonna do is with my hands on your feet, same thing. So I'm gonna put my hands right here. You're gonna go ahead and move them towards you. Okay.
Pull.
Kind of. Yeah. So if your feet are like this,
Yeah.
do that.
Okay.
Okay. Okay. So go ahead.
Go ahead.
Towards you. Just your feet. Just your feet.
Just my feet. Okay.
So like that.
Oh yeah.
Yeah. So go ahead. Good.
Yep.
And go ahead and push against him. Good. So the patient's strength on his feet, 5 out of 5 as well. And now I'm gonna have you try and lift these up. Okay.
Yep.
So go ahead.
Both at the same time.
Or one at a time.
Okay.
Good. Other one. Good. All around, patient's extremities, upper, lower, neck, shoulders, all 5 out of 5. Very strong patient. And now what I'm going to do is I'm going to check the cap refill on your toes. Okay.
Yeah.
Okay. So under 3 seconds. That's what we're looking for. Good. 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 Capillary refill on patient's lower extremities under 3 seconds, meaning that there is proper circulation. And what I'm going to do, since I'm already down here, I'm going to check your dorsalis pedal pulses. Okay.
Okay.
So I don't know if I think you can see. So yeah, I feel it right there. 2+ equal bilaterally, and I'm going to move behind your ankle right here at the posterior tibial. Awesome. 2+ equal bilaterally as well. And I'm going to check your popliteal, which is right behind your knee. Okay.
Yeah. Yeah.
Okay. I found that one. I found your left. Now I'm feeling your right. Perfect. Good. And throughout this assessment, I forgot to tell you earlier, have you felt any pain whatsoever?
No pain.
Like me checking your pulses or your range of motion? Nothing?
Nothing.
Nothing. Perfect. Okay. 2+ on the popliteal, equal bilaterally as well. Patient has very good circulation, and we would also assess the femoral, but it was stated that we don't have to for this one. So I'm gonna go ahead and not. Now what I'm gonna go ahead and do is I'm gonna check his abdomen.
Yep.
So here, Ty, I'm actually gonna have you hold this.
Yeah.
Yeah, so hold it, point it a little bit towards your stomach. All right. Here, I'm gonna hold it for a sec. Go ahead and pull your shorts down a little bit.
Yeah.
Yeah, that's good. So go ahead and hold it like that. Perfect. All right. So, perfect.
Okay.
Here, move this finger.
Oh, my bad.
You're good. You're good.
Like this.
There.
Go
Perfect.
Okay.
That's perfect. Gonna go ahead and have. Damn. Okay. So, looking at the patient's abdomen right now, I see no masses, no lesions whatsoever. There's also no bruising. Now I'm gonna go ahead and, I also should have mentioned that there was no labored breathing earlier when I was assessing his respiratory. And for this, what I'm gonna do is I'm gonna split his abdomen into 4 quadrants. Right now his umbilicus is midline to his body, so I'm gonna go ahead and split it horizontally and then vertically. Hair is also present. Skin is pink. It has pink undertones. It's appropriate for ethnicity. So divided it. There we go. And what we're gonna do is first we're gonna auscultate for some bowel sounds. All right. Switch it over from the bell. All right. Listening in 2 spots of each. Okay. Okay. So the patient's bowel sounds were active in all 4 quadrants. Yeah. Did you feel any pain while I was doing that?
No pain.
No? Okay. Tilt it down a little bit more.
Yep.
And while I have my stethoscope right now, I'm also going to check his renal arteries, his aorta, and his ileocecal. So to do this, I'm going to make a V with my 2 fingers. His renal should be right there. And with the bell, I'm going to be listening for some bruise. Okay. Okay. All right, so no bruise were heard in his abdomen, or in his ileocecal, renal, and aortic arteries. So now what I'm going to do is I'm going to go ahead and percuss, and I'm feeling for tympany. What we're looking for is we're expecting some dullness because the intestines are right there. There's not a whole lot of bounce back, but you can tell right here, especially, I feel some hollowness. Okay, so tympany was noted throughout, slightly dull. And now what I'm going to do is I'm going to perform a soft and hard palpation, okay? And while I do this, go ahead and let me know if you feel any pain, okay? Okay. And I'm doing this in a circular motion because if there were any masses, they do tend to roll away from you. So there's nothing there. Now I'm going to do a harder palpation, okay?
Yep.
All right. Really sorry if this hurts.
It's all good. Good thing I have a lot of abs.
Yeah, dude. You're ripped, bro. Nothing?
No pain.
Okay. I'm going to go ahead and pick this up. And go ahead and sit up for me. So, so no masses, no lesions were felt, no lumps in the patient's abdomen whatsoever. Okay, I think for subjective questioning for your abdomen, I did forget to ask if you were sexually active.
Yeah, no.
No. Okay.
No.
Okay. All right, but if you do, make sure to practice safe sex,
Yeah.
all that, condoms. The only contraceptive that does protect against STDs.
Yeah.
Okay, and for the final portion of the video, I'm gonna go ahead and let you in on some information that could potentially actually save your life, like dead serious. Testicular cancer is obviously a very big issue. So it's very serious. So when you're in the shower, what you should do is every once in a while, I want you to go ahead and put one testicle between your thumb and your index finger. Feel around for any bumps, anything that wasn't there previously.
Yeah.
And if there is something, you can go ahead, go to your doctor. Even if it's nothing, even if it's just like an ingrown hair or something, it's best to know.
Yeah,
that to
before
not
it happens.
Right,
Yeah.
exactly. And I actually just remembered that I do have a few more things to do, if that's okay.
Yeah. Yeah.
So I'm gonna have you go ahead and lay back down. Yep, perfect. So I'm gonna be performing a Babinski test on you. So I'm gonna run this spoon
Yeah.
up each foot, okay?
Yeah.
Okay. Good. It's a weird feeling, I know.
Yeah, it's weird.
The patient tested negative for Babinski, meaning that his toes curled inward, which is appropriate for anyone older than an infant. Now what I'm going to do is I'm going to kind of poke you and you're going to tell me if it feels sharp or if it feels dull, okay?
Yeah.
Okay.
Sharp.
Dull.
Okay.
Dull.
Sharp.
Sharp. Alright. Very cool.
Kind of kill me.
Dude, I really am. Okay, so one more quick thing. Let's step back over here. Okay. The patient, from the looks of it, it doesn't seem that they have any sensory deficits. And what I'm going to have you do right now, actually, is so I'm going to have you put your feet together.
Yeah.
Feet together. And shut your eyes.
You're not gonna hit me, are you?
No. Okay, perfect. All right, so I just performed a Romberg test on the patient. He does have an atrial sway, but that is to be expected. If it were anything like him stumbling over, that would be indicative of poor balance, but it doesn't seem like he has that issue. And now what I'm gonna have you do, Ty, is I'm gonna have you go ahead and walk down and walk back, okay?
Yeah. Just natural.
Yep. Go ahead and walk back. Perfect. So the patient has very well balanced, or very good balance. He wasn't stumbling, very appropriate gait. And yeah, just to recap, no abnormalities heard in either his lungs or in his heart, and his arteries. No bruises were noted in his carotid, his ileocecal, his renal, his aorta. S1 and S2 sounds were they were regular rhythm. No S3, S4. S2 all across the board was pulses ranging from his dorsalis pedis all the way out to his carotid again. Equal lung expansion bilaterally. Tactile ephemeris. There was the vibrations did diminish on the way down. Yeah, and he appears to be mentally all right. A&O times 3, and that would conclude the video.